Knowing your body is a great way to prevent long-term health complications. This can be done through women's screening tests, one of them being cervical screening tests. So this is available to all women after the age of 25 who are sexually active up until the age of 74. It's recommended we do this every 5 years unless there are abnormalities. It can be done in a healthcare setting through a self-collect kit, or it can be done with a healthcare provider. The self-collect kit comes with a swab. You simply insert this into the vagina up until the index finger and swirl it for 20 seconds, then pop it back in. Once you're done, you give this swab back to your healthcare provider. This tests for HPV cells or human papillovirus cells that are abnormal. If there is an abnormality, it does not necessarily mean you have cancer. It will just be something that requires monitoring. The next screening tests available are mammograms for those who are 40 to 74 years old. So those who are 50 to 74 do receive a reminder in the mail to book their test. It's a 20-minute test that's recommended every 2 years for breast cancer checks. You can also self-examine regularly to make sure that there's no abnormalities there. Another screening test are bowel cancer checks. These are available for free every 2 years for those who are 45 to 74 years old. However, it is important to note any unexpected weight loss or changes to your bowel habits to your GP. Skin checks are also important and can be done annually. It's also important to make sure you report any kind of changes that you notice in your skin to your GP. Another way women can know their body is through understanding their menstrual cycle and reporting any kind of changes to it. Monitoring for red flags including intermenstrual bleeding, so bleeding in between your periods, and also pain after intercourse, and also if you are to be bleeding after menopause, having extremely heavy bleeding. These are all things that need to be reported to your GP. Lastly, it's important to monitor our vulval health and be aware of it. So that is the external area of our genitals, because sometimes it can cause conditions that lead to pre-cancer or cancer. Make sure to see a GP if you notice any signs of infection or any changes to your vulval health. Celebrate Women's Health Week by starting your journey to better women's health. Book your appointment with an Evoca professional today.